All right. Hello, everybody, and happy St. Patrick's Day. I just was reminded that it is St. Patrick's Day, looking at Katie and Elizabeth here joining us. I did remember for my kids, at least they all went in green, but I am not wearing green, so I'm going to have to change that. But thank you so much for those of you who are joining with us live, for attending, and for those of you catching the repeat. Please feel free to reach out if you have any questions to either myself or Elizabeth and Katie. They are also slightly famous in the Freedom Healthworks realm, and that they've been on our podcast, Healthcare Americana, and on all sorts of other things going around. They are super passionate about nurse practitioners in direct primary care, and as we are as well, and have been just a great resource for any nurse practitioners or physician's assistants looking to get involved and helping to just remove as many barriers as possible. So we appreciate that, ladies.
We're so happy to be here.
Yeah. Do you guys want to hop in with an introduction kind of about how you met and how you ended up in DPC?
Sure. Let me start. Go for it. All right. I'm Katie. I've been a nurse practitioner for about 12, 13, 14 years. And Elizabeth and I kind of knew each other through a mutual friend, and then she decided to go back to school and become a pediatric NP. And when she was doing that, she did her clinicals with me. Mm-hmm. So that was really fun, and we got along really well. And then she took a job and kind of did a couple other things, and then ultimately we ended up working at the same primary care practice on the south side of Indianapolis for a couple years. And both of us working down there, we both live on the other side of town, and it was long days, and it was not super convenient for us to get down there. And we both just kind of thought, we need to be doing something different. And I knew there was other options out there. I just didn't know how to do it. And I would have to say Elizabeth is probably the one that really pulled me in and taught me about freedom and was like, we can do this. She was definitely the motivator behind it.
I love how you guys balance each other out. And that's something that I've seen a lot with talking to so many different practices, especially in primary care. Of anyone who comes with a partner, it's always so interesting to see that there's usually two pretty different personalities. I mean, your values definitely all align, but you balance each other out so well.
We were joking yesterday about how we're turning into like a married couple. So
I can see that.
Yeah.
Finishing each other's sentences. I totally can see that. That's awesome. What about you, Elizabeth?
Married couple. Sorry, what did you say?
What about you? How did you end up coming to DPC and besides me pushing you that way?
As Katie mentioned, we after I had left like a big hospital system, and I started working at her office, which was amazing, and loved working with her again, and it was a great office. But again, like she said, it was just hard. Number one, driving down to the south side, I just felt like I was not with my kids when I wanted to be with my kids. And we both have kids, and all of our kids have schedules, and it was just getting difficult. And I think for me, the big push was coming from a specialty going into primary care. I was used to slightly longer appointments, but still, in my opinion, not long enough. And I just wanted to have more time with the patients and really connect with them. And so that's when I kind of started complaining to friends about what can I do to make these appointments better for the parents and better for the kids and better for me, and feel like I'm giving the best quality care and giving them the time they deserve. And that's kind of when we were brainstorming. And of course, that's when I also found Freedom. And I was like, this sounds like something, because like I said, we were both working at the time. We both have husbands and families and just so much going on. And so I think the thought of opening our own practice, when I had talked to you and you had told me about it, I was like, oh, there's no way I can do that. And that was just my automatic, thought to myself. And then I was like, well, and that's when I spoke to Katie about it, because she had always talked about how she would love to do something along these lines, but just didn't know it was called DPC and didn't know there was this movement. And so anyway, the balls all kind of fell into place, and it's been great.
Here we are a year later, over a year later.
And I should probably give the disclaimer that I have selfishly really enjoyed you guys getting involved, because you're actually my providers for my kids.
So yes, lucky us.
Well, Lucky you getting lots of texts from their mom.
That's what it's about, right? That's so fulfilling for us to be able to be there like that.
Yeah.
So
And you guys really changed my perspective, of course, being, I'm the business development manager for Freedom. And so I get to have a front row seat to a lot of these changes of people coming in with the idea of, do I want to get involved? Is this something I can do, all the way through to seeing it a reality and a success, which is so fulfilling for me. But getting to experience it as a patient was so different, and just, really aligned things for me for why this is so important, not just for physician burnout and for physician and provider safety, but also on the patient side of just the impact that it makes on families. And I'll get into that a little bit later, and I'm going to try not to cry when I talk about that, but I feel like I cry on just about every webinar, so you guys are probably used to that at this point if you've been tuning in. But it is just such an exciting thing to get to see people kind of have that life come back to their eyes again and get to practice the way that they've always wanted and why they got into medicine in the first place.
Yeah.
And
We might feel cheated if you don't cry.
okay, I'll try. I will attempt to cry. What made you work with us? What made you decide we're going to go with Freedom instead of doing it on your own? I often will say to people, of course you can do this on your own. Like, just like you can build a house. We love metaphors here. Just like you can build a house, you're perfectly capable. You can YouTube how to start the foundation, all of those things. There's no doubt in my mind that the majority of people I talk to could do it on their own. But I like to say, why not work with someone who's done it 100+ times before and already can, know the ins and outs, save you money, save you time, more importantly.
I think that's really what it comes down to, basically, is it was the overwhelming thought of, okay, we want to open a practice, but how the heck do we do this? And that was just too overwhelming for us. So when we initially thought about it, and I thought to myself, there's no way I could do that. That's why it was a no-brainer for us, because you guys came in and you took care of all of the things that we did not know how to do, or did not want to do, or did not have the time to do, because we were still working and we were already burnt out, and that affects our home life and our kids and our husbands and all those things. And so it took all of that out of the picture. We knew that it was going to open correctly, that all the T's were going to be crossed and I's dotted and all the things, and we didn't have to worry about it. And so for us, it was worth every single penny for that reason, knowing that we would only have to do the things that we were trained to do, which is take care of patients. I don't have any business courses from school, and I don't have any background in opening an office and web design, and, logo design, like all that stuff was just so overwhelming to think about. And so to have someone just be like, nope, we got you. It was awesome.
Yeah, I totally agree. There was no reason to reinvent the wheel. You guys are good at what you do. You've done it for a while now. And I think we had all the confidence in the world knowing that you guys were handling all the important things behind the scenes. And we got to focus on the things we wanted to focus on, which was, how are we going to run this practice and how are we going to make it as good as we can for our patients and our families?
Yeah. Oh, I love that so much. Dane Delosier, who's our Chief Operating Officer, he'll be on our next webinar in April 7th, coming up to talk about entrepreneurship in DPC. And, he always says, we want you focused on your best and highest calling. That's a Daneism. I'm sure you guys have heard that many times before from him. And I think that just sums up what you said, Katie, about reinventing the wheel. It's not that you can't do it. We truly, truly believe in it. I mean, anyone who's looking at DPC is not someone who just goes with the flow and does things because it's the way it's always been done. You can do it on your own. It's just, can we get you focused in front of patients faster? Can we get you out of the situation that you're in, or that most people come to us and of, seeing 35 patients a day at 15-20-minute visits, into seeing people maybe 8 tops a day in 60 to 90 minutes. You guys are probably closer to 90 because you're so stinking thorough, and kids are a little more, usually have a few more things going on than our internal med docs see. But I think that's just such a big change. That's something that really stuck out to me, Elizabeth, with, hopefully you don't mind me sharing this story, but I remember kind of your final straw being of like, I'm going to make this jump. You had seen a teenager that was struggling with depression. And I think you said you were only able to spend like 15 minutes with them, or supposed to. I know, I'm knowing you, that you spent a lot more than that probably, and paid for it later that night with charts and things at home. But that it was expected of you to see a patient and quickly and get them in and out, rather than really getting to spend the time to approach, teen mental health. And gosh, are we, seeing the consequences of those exchanges right now. So
Yeah, it is.
you think that was kind of your final straw?
Yeah, I think there was that, and just feeling like I hate having to tell them, okay, we don't have enough time to discuss all this right now, especially when you have a kiddo who's finally opening up about it, and then having to say, make another appointment, come back. And so I couldn't do that. And then that puts you behind. And when you're seeing 4 patients an hour, even if you spend an extra 15, then everyone behind you, like you just keep getting more and more behind. And I just hated feeling that way. And then another scenario was just, when you have these parents with newborns and they're just not used to newborn breathing and what's normal, and they get panicky and they call you and it's RSV season. It's, well, is this RSV? Is my kiddo struggling to breathe? And when you don't get to have the relationship that you have here with the DPC model, you're just telling them, oh, if you have concerns about their breathing, go to the ER. And I hated that. And so I was constantly giving patients my cell phone number and FaceTiming to be like, nope, that everything's fine. Or yes, I do want you to go to, I do want you to go to the ER, or whatever it was. But 95% of the time, the infants were fine. And so we were able to save them a visit to the ER, which is thousands of dollars. But I guess technically you're not really supposed to do that. When you have a panel of 5,000 in an office versus a panel of 500 or 300 or whatever you decide to have, you have that relationship here. And that's what I love. I love being able to just quickly text with a parent and reassure them so that they can go back to sleep, because we all know how sleep deprived we are when we have babies at home. So I just love that, being so close with the parents and the patients, and really truly being able to care for them at a different level.
Yeah. I love that. And as a, patient of your practice, I know how much time that you're able to spend there. I often tell the story about my son. I have 3 boys, and one of them has some sensory disorders. And I remember just feeling, even as a nurse, very overwhelmed with what do I do? What resources do I get him? Behavioral things are a lot different than medical things. And even then I always helped adults, not kids. So I just felt so overwhelmed. And I remember after meeting with you guys the first time, and you taking your time to spell out every referral we needed, figure out, what labs we needed, literally sitting on the floor with him to connect with him. He loves actually going to the doctor now. He totally trusts and is very probably too much himself there and way too much at home compared to other places. But we never had that experience. Our previous pediatrician was wonderful, great person, but she had all those same things that you just pointed out about having the, overflowing schedules and things like that. I never had an experience where she was able to take the time with him that he requires to get somewhere. And it has affected our entire family on so many levels, not just the kids. So obviously sing your praises for that, both of you.
I mean, that's why we are so passionate about this, because I wish that we could just tell every pediatrician and every, advanced practice provider that wants to care for kids, like there is a better way, because at the end of the day, all of these pediatricians are wonderful. They chose to go to take care of kids for a reason. There's a special kind of person that does that. And so it's not that it's the barriers in the system, it's not them, it's it's the system. And I just wish we could scream it from the rooftops, like there is a better way.
Yeah.
You can do this. And so,
I mean, along with, not having to see patient after patient after patient, being able to spend more time with people, our day is a little more open, which gives us a lot of flexibility also, not just in our personal lives. I can run to my kid's school and see that play. I can, which I love. But from a professional standpoint, it's allowed me personally to get certified in things that I never would have had the time to do if I would have stayed in traditional healthcare. I have become certified as a car seat technician. I got recertified as a breastfeeding counselor. We've taken on some new kind of aesthetics type of things that we've had to work and do some training on. But even just learning more about the things I already know, I love having that additional time to do those things. I'm actually in the middle. There was a dermatology update last month that one of the hospitals was doing that I couldn't watch live, but I'm like halfway through it. So, so just being able to update my own skills and my own knowledge and
Yeah.
look into new resources and new research in order to keep my practices up to date is good for me. And that is definitely one thing that I was not doing before. I just did
Yeah.
not have the time or energy.
Yeah. And you're on empty. Who wants to learn
Yeah.
more when you're at that point?
Yeah. So you do
Yeah,
your
that's
required continuing education and, but now it's like we look forward to more education. We look forward and we've reached out to chiropractors and integrative medicine people and holistic medicine people, just so that we kind of have, even in our mind, the more knowledge you have, the better, right? And so it's nice that we're able to deep dive. So when we have someone who's saying, oh, I'm taking my baby to see a chiropractor. Before, we had zero time to look into that and learn about it. And now that we do. So it's just, it's great. We just feel like we're better moms, we're better wives, we're better, pediatric nurse practitioners since switching. So.
Yeah. Oh, I love that. And I think, Elizabeth and I both were able to attend a conference recently. Shout out to Dr. Barry, putting together a wonderful conference. If you're in pediatrics, you absolutely want to go. I don't know if I'm supposed to be advertising this, but I've been telling all of our family med people too, because it was such a great conference to learn if you're someone who's serving kids. It was the very first ever pediatric DPC mastermind. And one thing I love that we kept hearing over and over is, if you've seen one DPC, you've seen one DPC. And I think that's so cool. You guys just touching on your specialties, I think is another great way to go. People kind of get in their minds when they're coming in not familiar with business, especially, I have to serve everybody. And they get exhausted thinking about how they're going to serve every possible person and make themselves into that fit, especially opening your own practice, when in reality, the more you can niche, the faster you're going to build that clientele. And you guys, Katie, you mentioned your car seat focus, your lactation focus. Elizabeth has I'm going to say borderline obsession with sleep.
I would agree with that.
That's fair.
I think that would be an appropriate assessment there, but in a healthy, maybe
a healthy obsession. Yeah,
healthy obsession.
Towing the line of it. No, I'm just kidding. A great obsession that's a huge game changer for my family. It was really cool because one of the things you think about with sleep is newborns, but you guys actually help older kids too, and kids with sensory disorders, like I mentioned. And I've seen a few of my families. One great thing when you're providing service is a good service to your patients is they become your salespeople. So of course I'm shouting from the rooftops all the changes we've experienced, and then been able to pass that off to my kids' best friends too. So I've seen that sleep help in action in multiple households, and how big of an impact that makes. And can you guys talk a little bit about what you do for the 4th trimester as well?
Sure. One of the things that we love about our DPC is we offer up home visits. If you join our practice as a member and you have a newborn at home, we will come visit you at your house for the first 3 months. So that is scheduled visits, that is worried mom visits, that's weight check visits, lactation, counseling, whatever it is you need those first 3 months, we will come see you. If you want to give a gift to someone, or if somebody's on the fence and just thinks, I don't know if I'm ready to make this jump, but I really love the at-home idea, then we are offering a 4th trimester package. And in that 4th trimester, we basically offer the same things that we do with the first 3 months of a newborn membership. And it's an at-home. It's basically, we come visit you at home for the first 3 months of your child's life. We will do vaccines, we will do newborn visit, we will answer all your questions. I check the car seat. If you need that, we'll do lactation. We'll do anything you need for those first 3 months. And then if you decide to join our practice, awesome, we would love to have you. And if you don't, that's fine too. And we will forward all your records on to whoever your new provider is. We honestly, I would love to take credit for this idea, but it's been around for a little bit, and Elizabeth and I saw it through some other people's practices and just thought it was a great idea. We do price that a little bit higher than a regular membership, because we really want to encourage those people to join the practice. Obviously, we want to build those relationships. We want to watch your child grow up. We want to help you through all of that. And we want you to stay with us. So, we do price that 4th trimester package a little bit higher to discourage people from just kind of buying the package and automatically moving on,
Okay.
if that makes
Cool.
sense.
Yeah, it does. And
No, I mean, I think it's nice for parents to know, okay, well, I can have this for the first 3 months and there's no true like 100% commitment. So for some, they need that, but we've never had someone come as a newborn and then, I mean, usually, and then leave. They're just like, oh, I can't believe how nice this is. I mean, I think back to when I was a new mom and I had, I had a toddler and then another newborn, and I couldn't even drive myself to my own first newborn visit or any of those weight checks. You can't carry the car seat. I mean, so there's all these barriers for mothers. And so it's really, it's so nice when you get to the home and the parents, like, you have no idea what a game changer you coming here has been. They get to be in their PJs if they want to, nice and comfy, and there's no stress about like getting up and after you're sore and having to go in a car to an office carrying all this stuff. So it's been nice.
And especially we're in Indiana, and I mean, we didn't have a ton of snow this winter, but we definitely had some snowy days. And there I was driving to downtown to visit, some newborns on some of those snowy days. And I don't mind it, I love doing it, but I just think that new mom, like what I would have given to have stayed in my pajamas in my warm house.
yeah. And especially if you have other kids, not having to tote them with you. I know. I can't imagine someone having that experience, especially a new mom, and then transferring to traditional practice and seeing the difference there and not running right back to your arms that day, maybe. So I know I also think it's interesting in pediatrics, we typically don't see people joining a practice that's just one person. It's usually all of the kids, especially in Indiana. We know we have big families here. But I laugh thinking about a friend of mine who joined a DPC recently with just one of her kids. And then I think they passed on strep or something to the other kids and quickly enrolled the rest of the siblings within the same week or two. So I think that's a fun thing with pediatrics too, is you really do get to see the whole family, especially if you're going to their home at the beginning there. It's kind of a nice way to really be able to assess things in a different atmosphere.
And we do like to keep it affordable for these families. I mean, we understand, like, you've got 2, 3, 4, 5, 6 kids. So we do like to keep it affordable. I mean, so we do max out at a family of 3 kids. So if you have more than 3 kids, they get to come along for the ride, which I think, is nice for those families. I mean, the chances of all your kids needing something all the time is pretty slim, but you're probably going to have a couple that are going to need more than the other one.
Yeah. We won't name them, but we all know who they are.
There's one in every family.
Always. Let's talk a little bit about the pricing. You mentioned that, Katie, for people who are new nurse practitioners or physician's assistants looking at DPC, how did you guys come up with the pricing that you landed with?
Well, truthfully, Freedom helped us with that. So they did some market research for us. And I mean, we did it on our own too, but it's still, again, we're not business people. You can bring us a sick kid and we'll know what to do. But when it comes to that kind of stuff, it just wasn't our cup of tea. And so we looked at other practices in the area, and there's not a ton for that focus on just pediatrics. So that made it a little bit easier. But you guys also did the research for us as well. And so that was really helpful.
I also think, we did take a look at the traditional model, and you look at people's insurance plans and you think, okay, what would this typical family pay in a month to if they're at a traditional pediatric office? And, they might have a $20 or $30 copay. Okay. That's probably true. Let's say they got to go in for a sick visit. Okay. That's another $20, $25. Okay. Let's say, that they got sick on the weekend and now they have to go to the ER. Okay, well, that's probably an $80 copay, or an urgent care visit's an $80 copay. So, you're looking at 1 month right there, one kid, that's over $100. Whereas they could pay $100 a month, come see us every week if they want to, and we're not charging them any more than that. Yeah. We'll test them, we'll do all their stuff, we'll test them for strep, we'll see them, we'll listen to them, we'll weigh them, we'll do whatever your concern is. But I think for a lot of families, knowing that, hey, I'm gonna pay this flat monthly fee and get all my needs taken care of, I think that's very reassuring for some people financially, to know that
Totally.
that consistency is always there.
Yeah, they can budget for it, basically. They know exactly what they're going to spend and they
Mhm.
can budget for it. Whereas when in the traditional model, you have no idea. You're going to have co-pays, you're going to have surprise bills that show up for labs, et cetera.
Yeah.
You're going to pay that copay every time you're seen. So maybe you have a kiddo that has ear pain. You bring them in, the pediatrician says, nope, there's no ear infection, just keep watching it. Well, the next day they're worse and they have a fever. You're bringing them again. There's copays for every single one of those. The other thing that I think that's really wonderful about it is, so many things with kids don't need to actually be seen. And I think that's something that I never really realized before coming into DPC. So you have a parent that calls and said, hey, my kid's got a snotty nose and they're just not acting right. And then you're going to get a nurse line or you're going to get a front office staff person. They're going to say, bring them in. Well, with us, you can talk to us and we can go through everything with you and say, you know what, I don't think they need to be seen yet. Do X, Y, and Z, and let's keep in touch. And more often than not, you can save these parents from having to come to a visit. And they just need that reassurance. And I think that's the other wonderful thing is I would say a good 50% of visits probably don't need to actually be seen. Would you agree?
Yeah. A lot of, one thing I love about peds is I love reassuring the moms. And that's what a lot of our job is. And I love that aspect of it.
Well, I think, you talked about your aesthetics program on the side, which by the way, is for adults, not kids.
Yeah.
And I thought that was such a brilliant idea on your guys' side because so much of what you're doing is caring for the full family. But I mean, I think it's a pretty rational generalization that it's usually the moms that are making the medical decisions and the caring for the kids when they're sick. I don't know about you guys, but my kids are never yelling for daddy when they don't feel good. Unless it's daddy, bring mommy water.
Right.
But I think that is so important. And I love that you've added aesthetics too. So it's like, oh, you're scared to get your flu shot? Watch mommy get hers in her forehead. But I think that's so true. And you guys do such a great job of coaching through all those things, and timing being a big part of that. A story that I love to tell about my experience with DPC is, like you touched on finances. My husband is the most frugal person on the planet besides maybe Elizabeth's husband. And it took me a while to get him sold on paying for a membership. And we have 3 boys that are really close in age. They're 2 years apart. And I think we spent over $300 one month last year, and 1 month alone. I guess it was 2 years ago because it was during COVID when you needed the swabs from a doctor's office to go back to class. And then of course they got strep at a separate time than that and then passed it all around and pink eye. I mean, it was a horrible month for us. But especially my last point for him was when Harris, my youngest, busted his chin open at the park. And out of having 3 boys, it's been 9 years with no stitches. So I get like a special gold star for even waiting to get stitches. But he definitely needed them. And he was with my father-in-law at the time, who's a physician. And he said, I'll meet you at the ER. He's definitely going to need stitched up. And I was like, no. So I texted you guys a video of his chin and what that looked like. And you said, yeah, meet us in the office in 20 minutes. We got there. He already knew both of you. So it wasn't an uncomfortable situation for him. We knew who we were going to get. I wasn't worried, oh my gosh, this is going to be a resident who's never done this before, that, it hasn't worked with kids or anything like that. We knew the price it was going to cost, as it wasn't anything additional to our membership. And it was a great experience as far as stitches can go. He ended up just needing, I think you ended up gluing it and butterflying it or something, didn't you, Katie? Yeah. Got all cleaned up. My husband and I didn't have to call off work. Of course I timed it because I'm weird like that. And it was an hour and 6 minutes after it happened. We were leaving the office with a great experience and not wondering pricing or anything. Now, a year ago, we would have gone to the ER when that happened, probably as hard as he got hit, needed x-rays or something like that, had to wait God knows how long. And of course, the experience would be nothing like what we got at your office. So thank you for that. But that's my favorite story to tell, to show that value of direct care. And having that transparency of pricing is such a huge help.
Yeah.
So.
Well, you're welcome. And that's why we're here. And that's why we're doing this.
Yeah. It's such an awesome service. So getting back to talking to other people looking into DPC, the number one question I get when I speak with nurse practitioners looking into this is always, can I do this on my own? Do I need a collaborating physician? would you recommend doing this with a partner? Those are I guess 3 of the top questions that I get, but it always comes back to, should an NP do this on their own, and can they? I know you guys have an opinion about that.
I mean, should they? Sure, if they want to.
Yes and yes are the
Yeah,
first 2 answers.
Yeah. You absolutely can, and you absolutely should, because it's going to be life-changing for you and the people that you're caring for. I liked the idea of having a partner for multiple reasons. Do I have to have one? No, I don't think so. But it's been wonderful for us because, like I said, we both have families outside of this. We both have young kids, and we wanted to be more present. So for us, we are basically both working 2.5 days a week, and sharing all of our patients. So it's kind of like we're one provider, but we split up the time, and that way we also get to have take call and switch on and off, so that you're not on call 24/7 by yourselves, which is probably fine because you don't get very many, because you have the time to spend with them when they're in. So you're not getting a whole lot of after hours calls. I think it wasn't too long ago, I tried to look into it. I was like, how many after hours calls or things have I had to do? And since we opened in July of 2020, I think I've had 15. Whereas I would have 30 in a weekend before.
Yeah.
So you absolutely can. And I love having a partner, but there are plenty of places that do not. And I think it's just kind of what you're looking for your work-life balance.
As far as the collaborating physician goes, that's going to be different based on where you live and what your state laws are. In the state of Indiana, we do have to have a collaborating physician. He or she does not have to be on the premises, but needs to be, I think, geographically available to us. And within our state, they have to sign off on 5% of the charts on which we write a prescription. So that is the law in our state. Finding a collaborating physician can be a bit of a challenge. A lot of the big hospital systems frown upon their physicians collaborating with someone outside of their system. So that takes out a good number of physicians, especially in our area. I mean, we have tons of huge hospital systems that are fantastic, but that took out, pretty much all those people. Luckily, Freedom was nice enough to help us find someone, and we have a great collaborating physician who also has his own DPC, which I think we're really lucky to have, because he understands what we're trying to do and knows the business model and offers us great pieces of advice, when not only about medical things, but also about business, the aspects of the business also.
Yeah. I think
I love that.
The DPC community is very strong and is wonderful in helping others who are trying to get into it. Because like you said, it's a movement, and I truly hope and want to help spread the word and get more and more practices like this open, because it's better for the providers and it's better for the patients. And I think, in their whatever state these other MPs or PAs are in, there's going to be DPCs, I'm sure of it. And if they can't help, there are other options. There are collaborating physician networks that you can pay for. It's going to be a little bit more expensive, I think, than if you were to know someone that's local to you and in your area and truly, behind the DPC movement. But there are options. So I wouldn't let a collaborating physician be the reason that you don't open a practice if you're considering it, because there are ways to get that figured out.
Yeah, and I think one thing with having, if you're not working in a partnership, there are plenty of NPs and PAs that own their practice without a partner. I think it makes everyone feel more comfortable. I mean, you're going to have your list of resources of people who you're going to be reaching out to anyway if something comes up of something you haven't seen before, or that is just kind of presenting in an odd way. And so I always think, the more the merrier when it comes to those
Totally.
minds. But
more minds are always better, I think.
Yeah.
So
I think even in a year, I've seen a big change in how many DPCs have come up, obviously, but it's a lot more common for people to find a collaborator that is another DPC than working with even those other agencies like that you mentioned that you can find online. I've even heard of people trading vacation coverage as part of that. There's all sorts of different things that you can work out there. But most people are more than happy to do that, and you help each other. It's not just a one-way street, and in Indianapolis, where we're both located, there's a lot of DPC options, and occasionally we'll have even, vaccines that somebody's looking for, and we're going within the network to try and figure out if anyone has extra that we can go about that way. So I think a big part of kind of a side of having a collaborator is just having that community and making sure that you're getting to know those other DPCs around you. I know even any type of small business, whether it's DPC or something else, I know a big fear of a lot of people is competition. And what most people are surprised to find is the collaboration instead of competition. And I would say the DPC world of all businesses is probably a great leader in that. You will find, number one, there's not a competition, because 500 patient panel max, there's a lot more than 500 people in Indianapolis that need care. So you literally don't have that competition. But with DPC, when you see more of them, that's actually better for everybody, because you're not having to overcome that hump of education of what is DPC. So that it's kind of funny, as it goes both ways. Even if you're the only one that is the DPC in your area, then that's great too, because you're bringing that education to them. You may see a little bit of a slower build because you're having to provide that part too. But I love how you said that about the DPC community being collaborators.
Yeah, that is a really true statement. And somebody who has a DPC told me that early on. She was like, bring it on. She's like, I love seeing more DPCs open up. And I totally agree. I always say to people, and that when I'm trying to explain to them what this is, I'm like, think about what's old is new again. I mean, think about the old doctor, living in your community,
Yeah.
And coming to your house and knowing your family and being able to tell you, hey, here's what to do. And that's what we want to do. We love being in the Broad Ripple area here in Indianapolis. It is a pretty tight knit community, and we're excited to be a part of it. We've gotten to do, on that same lines, we've gotten to do things since opening this that we didn't do before in traditional. We've gone to fun runs in the neighborhood. We've gone to family nights. We've gone to preschools and given presentations. We've done flu shot clinics for the community.
COVID
shot clinics. And, so even as MPs, like, this is bringing me back to my like RN roots, right? Which is never a bad thing. And I love being a part of a community. So I think, to kind of push the competition aside and just say, hey guys, bring it on. Like, let's do more of this. Let's help out the community as much as we can, because when it comes to healthcare, that's what people need. We need to help them out. We need to offer them preventative information and not just treat them when there's a problem.
Yeah. Elizabeth, one of the docs when we were at that conference said that your competition isn't the DPC across the street from you. Your competition is Orange Theory or, Massage Envy or Gucci. And I thought that was such a funny statement, but it really is so accurate. Is you're not competing with the other providers. You're competing with where people are spending their money and helping them make that health a priority again. I think especially our generation, who are mostly, that's where we're seeing parents of young kids right now, or the majority are in our age group. And I think we're seeing a big shift from how things were always done to preventative health. And what can I do before we get to that point? Why are we just treating sick care? We want to change things, and we see a bigger focus on nutrition and exercise and all sleep, for all of those things where we're wanting to focus. And I think we're seeing a much bigger group of people investing in that from the start. And sometimes it's easier to start there with your kids, and then it kind of spreads to the whole fam. So
I tell people that all the time. The habits that your kids create as kids is what is going to continue throughout their life. So if you can get them eating healthy, sleeping well, exercising, those are the things that you want to stick. And that's what's going to overall truly impact them as adults as well. And so if we want to change the health of the United States, this is how you do it. You do it in the kids. So it's just a very important population to be caring for. And we definitely don't take it lightly, but it's wonderful.
Yeah, awesome. Well, we've talked a lot about all of the positive things that come with DPC. I don't want to make everything sound so perfect. You guys have faced some hardships along the way. Nothing that's stopped you from keeping going, as I think you've come into it with the mindset of we're going to succeed and we're going to do everything we can to make it happen, which is a great mindset to come into rather than, gosh, I hope this works out. You've done the steps to get involved in the community. You've really developed that. You've developed a presence there where people look to you as pillars of health for what to do with their kids. And is there anything that you would caution someone, anything you caution them about getting into DPC at the beginning? Any mistakes you made that you learned from or that you'd like to share?
Yeah, I mean, we started small, and I think that was really smart. You don't need some big fancy office. This is not the same as the place that you're coming from. You don't need 4 exam rooms. You don't need, all the fancy equipment per se. And so just choose really well on what matters to you. And, we definitely wanted our office to be very friendly, and we didn't want it to be sterile like normal offices, and we wanted it to be kid friendly. And so for us, we decorated a certain way to make it that way, but we didn't spend, you don't need all the most expensive equipment. You don't need a huge space. So start small. And I'm so glad that we did that. But ironically, we just this week moved into a bigger office because we needed to, which has been great. And again, we still only picked an office that has 2 exam rooms because you don't need that. So you don't want to be spending too much money on rent and all the fancy equipment. If you can start small and just get the basics, I think that will have a huge payoff for you. I think the big thing was advertising. So marketing and stuff. So, we thought we were doing the right thing by putting an advertisement or marketing page in a magazine that is delivered to a bunch of local neighborhoods. And we just didn't see a whole lot come from that. It's been a lot of word of mouth and social media. So just don't spend your money on that. If you're going to do it, put it into social media or put it into going out into the community to runs and to sponsoring events, that kind of stuff where you're getting your name out there, and really get involved in the mom groups and stuff on Facebook, and even mom groups that just meet around neighborhoods and stuff, just to offer things to them. Like, it's just about word of mouth, I think.
Yeah, it's still a lot of general population education on what is DPC. A lot of people are aware that it's out there in the adult world, and even a lot of parents will go for themselves and never thought of it for their kids. So that's a lot of education, just educating parents on why it's different and why it could benefit their family. Educating people on the different kinds of insurances and why it's okay that we don't take insurance. That's a lot. And remember, people don't always jump right in the first time they hear something. That's something that's hard for us to remember because we've been talking about this for so long now. But if people are just learning about something, chances are they're not going to jump right in immediately. So you've got to keep, remember to stay in front of their face, have them follow you on Instagram and Facebook, send emails every so often, just reminding people, hey, I'm out here. If you're struggling, we're here still taking patients. And then hopefully, you get some great patients and families that come in, and word of mouth starts to spread. And that's one thing that I think has been big for us is just having some great families out there, and especially moms that talk about us and say good things and know that we're really here to help their kids and their families.
Yeah, you guys have done a really great job with your social media too. It's like, obviously I'm biased, but I love following your account. Freedom has helped with some of it, but
yes, they are awesome.
Really, the reason that Freedom has helped you is back to that best and highest calling, and so you can focus on your patients more. But you guys actually really enjoy social. Well, Elizabeth does anyway. And the majority of people I talk to are like, please take our social media off our hands. However, I think, Katie, that's a really good point of needing multiple touches. They actually say it's about an average of 8 touches for someone to convert. Now that doesn't mean you've talked to them 8 times, but that might mean a friend said something about it. their kid gets sick, and then they're like, I remember that friend who told me about how she didn't have to use urgent care anymore. And then they find you on social media and start following you. And then maybe they see a story that you post. Maybe they actually call your team and get in with you for an appointment, or what we call a meet and greet, where they can just come for free and get to, tour the office and learn what you're about. And then, maybe that meet and greet is what pushes them over the edge, but sometimes it's even more. Of longer time of them following you on social. I think for kind of our generation, that's a place that it is. Seeing you out in the community, driving past your sign. There's all of these steps that go into that. And I will say, though, you guys do a fantastic job of conversion once they're in your office. I'm not sure what you think.
I think it helps because they can see the difference, right? They can see that this is, we don't have a waiting room because we don't need one. We have one family in at a time. So guess what? That means no exposure to the kiddos sitting next to you in the waiting room who might have the flu or strep throat, It's just one of those things. And so it's more personalized, and we sit down and, like you said, we get down on the floor with your kid, and half the time while we're talking to the parents, the kids are playing with toys, and we can watch them developmentally and be like, okay, they're doing X, Y, and Z. And so that kind of is two birds with one stone, right? We're getting information from parents and we're watching it happen while the kid is playing with the toys. And it's just, it's great. I mean, it's just such a different experience. And I think that once they come in and they see that, there's really no turning back. I mean, if I had known, if there was something like this when my kids were younger, I would have done this in a heartbeat. I mean, obviously now we do, but an option when they were newborns. So, but yeah.
One of the comments that I hear the most from our team that helps enroll patients is people will call back and say, like, thank you so much for telling me about this and scheduling. Like, they want to just sing the praises and tell them what they experienced, which is a call that we love to get. But one of the number one is the doctor answered the door, or the nurse practitioner answered the door. Like, they don't even expect, they're used to coming in, checking in at the desk, waiting, telling their kids, stop picking your nose and eating it while you're next to the other kid, that's slobbering and chewing on the chair, and all those fun experiences of the waiting room. And they're so shocked that you come to the door and welcome them in. And a lot of our practices have snacks or coffee, it's really funny how little the change has to be for them to notice it even, so just coming to the door alone usually really shocks people of like, oh yeah, this is a completely different experience. So
you're going to walk in and you're going to see one of us, and we're the ones doing your vitals, and we're the ones answering the phone and texting with you. You're not getting a nurse line. You're not getting an MA, and they're all wonderful, right? It has nothing to do with that. It's just more about, we want to be involved in every step of it, especially right now in our first year, as we're learning all of our patients and getting to know them. Could that change at some point? We get an MA? Sure, maybe. But for right now, we do it all. And I think parents love that. And it'll always be that way with texting and phone calls and that kind of stuff. Like, if you have a question about your kid, you're going to get your provider, period. I think that's what a lot of people love about it, is you're not calling, you don't have a concern about your kid, and you're calling in, and then you're getting the front office, and then they're sending a note to the nurse, and then the nurse is going to call you back, but they don't have all the answers to your questions. And so then they have to go find someone, and then they're calling you back again. And it could be hours before you're getting any answers. Whereas with us, you can send us a quick text, like with your son, hey, does this need stitches? Yep, come on in.
Yeah.
Or, hey, like my son needs I think it's eczema, I'm not sure, but we're out of his eczema cream. And you could quickly send us a picture, and we're like, yep, we're going to send in your cream. You don't even need to come in. So it's just nice. It's just really been great.
Yeah. Awesome. Well, it just makes me so happy to see you guys so happy too. And I sometimes talk about how I got to DPC, but I haven't mentioned it here. I mentioned I was a nurse, and I actually started a company to help prevent burnout with healthcare providers, because I very quickly realized when I was working the floor that I liked taking care of my coworkers better than my patients. And as a child of a doctor and a clinical nurse specialist, that's probably not that big of a surprise. But I started that company, and I loved working with people and teaching them how to kind of delegate and take back their life and start caring for themselves again, and not just, I call it Groundhog Day, but rolling out of bed and the same thing every day. But what I really found was that I couldn't remove the barriers that were causing it, that were adding to it. And I came to Freedom, a friend told me about it and said, hey, why don't you consult for them for a month or two? And I was like, okay. And then I drank the juice. And now I'm here because this was really the solution of not only being able to take your life back and reduce burnout, but removing the things that are causing it, the insurance providers, doing everything based on coding and billing rather than what you're trained to do to care for people. Yeah. And the administration. A lot of times, I know you guys had a great experience with where you were before with your administration, but most of the time that's not the case. Most of the time it's pushing more numbers, telling you to go from 2,500 to 3,000 patients and take your time from 20 minutes down to 15-minute visits and even lower than that. So I think that this has been so fulfilling for me to get to see that. And then Elizabeth and I were friends before all of this, and getting to just follow that whole process has been just amazing. And I'm so grateful for all the work that you guys do, not just with your patients, but also with the other NPs that are looking into DPC. I think over the next year, 2 years, I think we're going to see a huge wave of NPs getting involved here. Yeah. And I think there's a few reasons for that, all of them that we've mentioned about burnout and wanting to care for people the way that you have. I think there is a difference in the way that doctors typically will care for patients as opposed to people who have gone through training as a nurse first and then to NP school. And this really resonates with NPs for how they want to provide care. I also think there's a big financial difference from working for a hospital network and owning your own practice. People don't realize how much of that payment of yours is taken and given to the insurance company or the hospital network. So that's something else to really consider. Now, given as you're getting involved, that first year especially is a big investment year. You're not going to start seeing that return until year 2 or year 3, where you're really feeling like, oh my gosh, wow, this was a big financial decision for my family. But again, back to Dane, he likes to say, you're not going to find a financial advisor in the world that would say, throw 50 grand in at the beginning and get a return of 300, 400,000 in a couple of years. They're all going to tell you to jump. So if there's anyone who's watching this back or attending right now that wants to know more about the financial side, you can always reach out to me. I'd be happy to run through numbers with you. Elizabeth and Katie are no stranger to our financial calculator. It is a famous tool around this area where we're able to really plug in numbers with you and play with things to see what it looks like, how you start your practice with X number of patients and what your pricing starts at, to see when you'll see that return on your investment. So don't shy away from the money questions. That's a really important piece of getting into your own business, and we're happy to tackle those with you as well. So thank you guys for being advocates for other NPs and for really pushing this movement forward and encouraging them to get involved.
Yeah, and please feel free to reach out to us. If you go to our website, Your Corner Pediatrics, there is a email on there, and it's our info email that goes to us. So feel free to email us if anyone has any specific questions or wants to delve a little bit more in depth into questions about it. We'd be happy to help you
and share our experience a little bit more.
Yeah. And then you guys make sure that you're following Your Corner Peds on Instagram. They do such a great job with their posts. I know you have all sorts of people that you love following too for inspiration that I'm sure you would share. But you should definitely get on and look at their layout of their practice. They have an awesome, I know you're in a new space now, but I'm assuming it's pretty similar, to see kind of what that setup looked like from year 1 and what they're recommending. You can see how it's really welcoming, but not a huge traditional practice with 6 rooms and things like that. So definitely check that out. And I think your email is info@yourcornerpeds.com. So you can email them there. But thank you so much for tuning in. And again, feel free to reach out with any questions. We're here, whether you decide to work with Freedom or go on your own. We're happy to help point you in whatever direction we can to push DPC forward. So thank you, ladies, for attending. And I hope you can enjoy getting back to your St. Patrick's festivities. Hopefully green beers in the future.
St. Patrick's Day. That's what I'm doing today.
Thank you so much for
having us. Oh, that counts. That totally counts. Thanks for having us today, Sarah. It's always good to talk to you.
Yeah, we'll talk soon. Great. Thanks, ladies.
Bye. Bye.